Hello, everybody. I am Melania from World Animal Protection. I am based in Costa Rica. In World Animal Protection, we move the world to protect animals. And we had a hypothesis, and it was that although mass dog vaccination is absolutely critical for rabies elimination programs, we feel that these programs must be more inclusive of humane DPM elements in order to make them sustainable in the long term. I want to clarify what we mean by humane dog population management elements, and Ellie explained it very well this morning. You know, education, veterinary care such as vaccination, identification, good use of holding facilities, legislation, reproduction control, responsible euthanasia. When we talk about dog population management as an organization, this is what we mean. This is an integral program in dog population management. The fact that we know is that as rabies is controlled, culling may still persist. Because mass dog vaccination, as you all know, will eliminate the rabies virus, but there could still be a high density of dogs, such as in the case of Mexico, where they killed many dogs because of just high density. They didn't have any rabies anymore. Then high turnover may sabotage vaccination efforts, so even if a government is vaccinating 70%, those puppies that die may If you're vaccinating, but you still have communities that are irresponsibly acquiring animals or abandoning animals or allowing dogs to roam on the streets, then clearly this is going to be still a problem for there to be roaming dogs on the street. And then there's other diseases. Mass dog vaccination for rabies gets rid of rabies, but there's other diseases like leishmaniasis or sporotrichosis, as in the case of Brazil, for example. So this leads to misplaced, cruel, and ineffective culling of dogs. Because all of these issues, culling, rabies, dog bites, roaming, are so intertwined and convoluted, we really wanted to understand what place does dog population management have in rabies elimination programs, or at least for the sustainability of the gains that have already been achieved through mass dog vaccination. There is published theoretical evidence that DPM is necessary, but there is very little, if no, practical evidence. And in part, it's because rabies elimination programs include mass dog vaccination, but also other elements of dog population management. And so it's very hard to compare one place with another. And there hasn't also been a full impact assessment done either of an integral dog population management program anywhere as far as I know. So we chose the region of Latin America because of the success that it has had as a region to manage rabies, and also because we know that they have implemented elements of dog population management into their national rabies elimination programs. So with the help of Dr. Evelyn Segredo, who is here today, our consultant, we reviewed international publications in the past 20 years that dealt with rabies and dog population management in Latin America, as well as national rabies elimination programs, documents, and reports from these 7 countries. Latin America has managed rabies very well in the past 30 years, and this happened because in 1983, all of the governments of Latin America came together and discussed that rabies was a topic of interest and it was a problem. And so they set a date to get rid of rabies as a continent. Obviously, there was interdisciplinary, intergovernmental, interorganization, collaboration and cooperation to achieve this, which has gotten obviously stronger through the years. There was political will with adequate resources, very important, and the international support of the Pan American Health Organization, which really was key to guiding and leading the countries along. They also made rabies of obligatory notification, and they placed mass dog vaccination as a critical pillar. The initial findings of our research is, on the one hand, obviously mass dog vaccination is absolutely necessary for rabies elimination, but that other elements of DPM are critical to sustaining those achievements. And I do want to clarify that if you ask any government in Latin America, do you apply dog population management? They will say no. Or maybe they'll say, yeah, we sterilize. So the concept of dog population management is not very well understood. And it might just be limited to them thinking that it's all about sterilization. So we couldn't really search the term dog population management in the publications. We had to go in and search these individual dog population management elements, like legislation, education, etc. So in general, in these countries in Latin America, most of them do use specific elements of DPM and rabies elimination programs, mass dog vaccination, obviously, but then also education, legislation, sterilization, and responsible dog ownership. For mass dog vaccination, as an example, in Mexico, they have a national rabies vaccination week. So in that 1 week, at least in the year 2000, they were vaccinating 13 million dogs. Obviously, that has gone up since then. That's just in 1 week, and then 6 months later, they do it again for those animals that weren't able to be vaccinated because they were sick or they were still puppies. Then there are education programs. For example, in the case of Peru and Bolivia, they have trained teachers to include the teaching students on rabies and responsible dog ownership in formal education. And then as an example of legislation in Chile, in this country, it is the owner's responsibility to pay for the rabies vaccination of the dog, and it's also the owner's responsibility, if that dog bites somebody, to be responsible for that. An interesting finding is that reproductive control is an intervention considered to be part of rabies control programs by most countries. Mexico states that they stabilize the population with sterilization and strong community engagement. So Latin American countries seem to agree that sterilization is an important part of rabies elimination programs. In the particular case of these Andean countries, responsible dog ownership is considered a key element in rabies control with those specific words. And it's interesting because that specific element was incorporated formally after they had outbreaks to improve public perception and dog bite prevention. And these were more recent outbreaks because we have been, the region as a whole, because we've been so successful in eliminating rabies, then the governments are very happy to say, let's stop vaccinating. We've already done what we needed to do, and rabies comes back. In Haiti, research in knowledge, attitude, and practice surveys, or CAP surveys, were key to understanding the perception of the disease, its transmission, and the impact on the dog-human bond. I had a colleague from Haiti, from the government, tell me that in his country, there are several places where if a rabid dog bites a child, then that dog is considered a demon. So people will run after it. Children will run after it with stones and kill it with stones. So if you understand that this is where these behaviors are coming from, that's really important to understand to move forward with the program. Most countries also use interdisciplinary collaboration, and by that I mean definitely the Ministry of Health and the Ministry of Agriculture at least working together. Then there is the training of professionals in all sorts of areas, and community participation, very, very important. One interesting finding is that no country has a strong, solid dog bite education and prevention program. There are also no public health policies to address dog bites. That doesn't mean that they do specific dog bite prevention programs. They might, but as a country, they do not officially anyway. However, most governments admit that an increase in dog bites is an important component of the rabies transmission cycle to humans. These countries have identified influential factors that determine the effectiveness of rabies control programs. One of those is the perception of risk due to improvement of the situation, which was what I mentioned earlier, in that we are victims of the success, and then when we think that we're doing great, then we loosen the guard, and then rabies comes back. Then there's the number of reported dog bites, which is always underreporting. Then the roaming dog density. These countries seem to agree that density is important in rabies elimination programs. the existence of rabies cases in neighboring countries, which is why it is so important for intergovernmental collaboration in the countries that border your own. Then there's the understanding of responsible dog ownership as a key component for rabies control. And these countries know that if there is no responsible dog ownership, then this is going to be a problem with the rabies issue. And then finally, obviously, the quality of epidemiological surveillance. This is super important in the continent. We do really good work on epidemiological surveillance, and when we don't, rabies gets worse. And then the percentage of vaccination coverage, which we all know is 70%, and they mention it both for dogs and cats. Now, this is an interesting find because you will see that all of this overlap with dog population management. So the countries and the Pan American Health Organization have identified that there are specific actions that are required to improve rabies control programs. But look at what they're saying. They're talking about more education about the commitment of owning a pet, so responsible dog ownership. Reinforce the need to care for true strays or community dogs. Creating awareness about not abandoning, the need to sterilize, the need to control the roaming dog population. Also, avoiding calling. These countries have recognized that calling doesn't work. It's expensive, it's cruel, it antagonizes communities, and it spreads the disease as well because people don't want their dogs called, so they take it someplace else, and if that dog is rabid, it's going to infect all of the others. And what we have been talking about today, these countries have identified that we need to encourage studies on dog population dynamics. Lots of overlap. So, with these results, we can conclude that there is a lot of overlap between dog population management and rabies elimination, both objectives and activities. So merging programs has potential and added value in the sense that if we merge programs, we can decrease the duplication of efforts, and we can also perhaps bring in more funding and expertise on board. Also, dog population has wider benefits than just rabies elimination. On the one hand, we're using the One Health approach. We're improving the coexistence between animals and people. And it's one solution for many issues. What we would use, the dog population management that we would use for rabies elimination is also much of the dog population management that we would use for leishmania or sporotrichosis or dog bites or all of these other issues. So rabies gives us an opportunity to talk about and introduce the topic of dog population management. Thank you.